This original WSRE presentation is made possible by viewers like you. Thank you.
Hi, I'm Dee Dee Sharp, and welcome to The Aware Show. We're glad to have you right there with us. Well, as many of you know, the Right to Medical Marijuana Initiative, better known as Amendment 2, narrowly was defeated at the ballot box just a few months ago. Well, Amendment 2's intent was to legalize marijuana use for patients coping with medical conditions, which a physician believes that the medical use of marijuana would actually improve the medical situation and would most likely outweigh any potential health risk. Well, the debate still continues. Those who are in favor of legalizing the medical use of marijuana, and of course those who are against it. Well, on this edition of The Aware Show, we're going to examine both sides of this issue to some degree. We're also going to look at why, for some families, the use of medical marijuana is not just about the quality of life, it's also about survival. Joining me in our studio for this discussion are my guests. They include this man, Dr. Ben Renfroe, a physician with the Child Neurology Center of Northwest Florida. Dr. Renfroe specializes in epilepsy, cerebral palsy, and dystonia in both adults and children. We also have Mr. Barney Bishop, a lobbyist, consultant, businessman, also president and CEO of Florida Smart Justice Alliance Incorporated. Next, we have this lovely family, Mr. Michael Johnson, his daughter Victoria Johnson, and of course his lovely wife Sherrie. The Johnsons have a very compelling story, and we're going to hear it in just a few minutes here on The Aware Show. But last but not least, one more guest for you. Joining us via the telephone, we have Seth Hyman. Mr. Hyman is also a parent advocate, a community advocate, activist, and business development director with Kelly Cronenberg Attorneys at Law in Fort Lauderdale, Florida. Mr. Hyman has spent countless hours trying to improve the quality of life and health care for children in Florida. We want to welcome all of our guests to the show, and we want to get started right off the top by going to the telephone and Mr. Hyman there. Thank you so much for joining us, Seth.
Thank you, Dee Dee. My pleasure.
All right. Seth, why don't you to tell us a little bit about your personal involvement with this issue we're discussing here on The Aware Show?
Sure. Thank you. About 4 years ago, our daughter Rebecca, who's now 9 years old, started to develop severe epilepsy. And she has a severe genetic disorder called 1p36 deletion syndrome. And due to her genetic disorder, she's nonverbal, she doesn't walk, she has a feeding tube, she's neurologically and visually impaired, but most of all, through all of her disabilities, Dee Dee, it's her intractable epilepsy, her epilepsy that can't be controlled by any traditional medications, that is basically taking years off of her life. She has sometimes hundreds of seizures a day. And about 4 years ago, I heard some stories outside of Florida and other states, particularly at the time in California, where parents of children who had special needs, especially seizures, were treating their children with medical cannabis oil. And it was basically a low THC, which is the compound in the marijuana plant that gives you euphoria. And it was very high in CBD, which is called cannabidiol, which is the compound in the cannabis plant that is supposed to help control seizures. And unfortunately, back then, there were very few states where it was legal. And I said, well, we need it here in Florida. And thanks to Representative Matt Gaetz and Katie Edwards, and many other families came together and came to Tallahassee and brought their children in wheelchairs, and we rallied the folks up in Tallahassee, and sure enough, Representative Gaetz sponsored House Bill 843, and that was really the very beginning. And that was the House bill. And then it eventually went on to the Senate side, and there was Senate Bill 1030, which was sponsored by Senator Bradley Bean and Brandis. And there were a lot of ups and down moments throughout the process, and sure enough, Senate Bill 1030 passed for the legalization of a low THC high CBD marijuana oil only. It's very limited on who could be treated and the way it could be used. But unfortunately, Dee Dee, we are still waiting for this oil to come to Florida. It cannot be brought in from other states. It is illegal. The only way you can use it to treat a medical ailment is, one, you need to qualify for it based on your medical condition, and two, which is most importantly, the marijuana has to grow in Florida, and it has to be processed and produced into oil here in Florida. Unfortunately, almost a year later, it is not available. It probably won't be available for some time. And unfortunately, families and patients like my daughter, Rebecca, whose life is in jeopardy every single day. She sometimes stops breathing, turns blue. Her life is in jeopardy because she does not have the opportunity to try this potentially life-saving medicine. And as a parent, it is beyond painful for my wife and I to see our child suffer.
And at 9 years old, I mean, she's lived many years having suffered, and I can only imagine. My heart goes out to you, and my prayers go out to you as well for you and your family, Seth. And thank you so much for joining us on the Aware Show to share your family story with us.
Thank you so much.
Absolutely. Want to turn a little bit to what you've been doing as an advocate. You mentioned your rallying support to Tallahassee with our politicians and our lawmakers to try to help. Where's that, and where would you like to see? Of course, where would you like to see this go? Sure. Of course, I know you want it right now, but you know, this is a process.
That's a really great question, because I think if it wasn't for the parents and the children showing up in Tallahassee, I don't think we would be where we are today when this started. And I started spreading the news about the potential benefits of an oil like this for children. People looked at me like, like a deer in headlights, and like they thought I was crazy. But then after the parents showed up with their children in Tallahassee before the legislature, and we testified at different hearings, finally the legislature and the politicians said, hey, you know what? What would we do if these were our children? And from seeing the children there and seeing the videos of the children suffering with seizures, I think our legislature incredibly made the right decision. And now we need to move faster, because time is of the essence. And unfortunately, the whole project has been stalled because there have been challenges legally against the state. And I would like to see this happen a lot quicker than it is. And I think my voice echoes for the many and the thousands of people throughout the state of Florida who would desperately love to try this medicine.
Echoing here on our set is a family as well, and we're going to get to them, Seth. We want you to stay on the line throughout the Aware program, if you will, because we want you to continue to join in on this discussion about medical marijuana and how it can help families like yours, your daughter, your 9-year-old daughter, Rebecca. So please stay right there. We'll get back to you in just a moment. But
Absolutely.
Okay, very good. Want to come now to the set where we have sitting patiently by the Johnson family. We have Sherrie and Michael, and in between here we have the lovely Victoria. Thank you, Victoria, for being so brave as to join us here live on the taping of this program. That's a very brave thing for you to do, and I really appreciate that, because people need to hear your story. I wanted to start with you, Michael, echoing what we just heard from Mr. Hyman there.
Absolutely, Dee Dee. My daughter is 21 years of age, was diagnosed with epilepsy at a very, very young age. There were certain things she was doing we did not understand. We were fortunate to have Dr. Renfroe in our community, and basically had come to him. We've been through several different types of medications trying to correct her seizures. You know, myself, I'm not a politician of any kind. You know, I'm basically just a parent who's concerned for the welfare of my child. The one thing that it gets really irritating to, someone like me is that it doesn't matter, you know, what the legislature's doing, doesn't matter what the politicians are doing. I want the best thing for my child. And when I see her go into a seizure, and I think that it's something that any adult parent were to see something like that, it would definitely change their attitude towards.
It would make you angry.
Oh, it does.
It would make you want to.
Quite honestly, in having to deal with this, and you know, you hear the terminology of red tape.
Yes.
It's to me as a parent, it's just, it's crazy that you should have to go through all this just to be able to get something in the way of a medication that can help your child. And you know, I know that there are a lot of different pros and cons as to why we should and why we shouldn't. You know, in my opinion, that should have no bearing on it. We should, right now, from my understanding, you know, we cannot even get, we can't even get the right information in order to be able to tell whether or not this is going to help our children. And you know, there's a lot of research that has to be done, you know, things of that nature. But if it's considered illegal, that to me just makes no sense whatsoever. So as a parent, it's very irritating, and you know, it's just one of those things that if she were to have a seizure sitting right here, right now, in front of, you know, some of these folks that make these policies, I'm sure that it would probably change their minds, or at least I would hope they would.
And I hope that it doesn't take that. I don't want to see her in going through that sort of thing. So I would hope it would come to that. Mom, very frustrating. I know it is for Dad, but moms, I know that's got to be really, really, yeah.
It really is. I mean, because especially when you're the one that's there majority of the time, and the one that's taking care of her during that seizure time, you don't know what to do. I mean, you do know what to do, but it's still a new experience every single time it happens. You don't know, is this going to be the time that she doesn't come out of it? Is this the one that's going to end in the hospital? You know, what do you do when you're sitting there watching your child shake and go into tremors and seizures and turn blue and, you know, it looks like she's going to stop breathing, but this time she doesn't. You know, we've done the medications, we've done the VNS implant. Nothing has worked so far. So we just want the next step, something that's better, that maybe won't have all the side effects of all the pharmaceutical type medication that's out there to try.
So you want an opportunity to give your daughter a chance with research.
Exactly, something that could possibly better her life.
Okay, and here joining us on the right of me is her neurologist. Thank you so much for being here with us, Dr. Renfroe. Tell us a little bit about your patient here, Victoria.
Well, I've known her for quite a while, and we have numerous patients that we call refractory. About 75% of patients that come to us with a new seizure will respond well to one medicine, maybe two. Those that don't respond to the first two have a very low chance of responding to a third, fourth, fifth, or 20th medicine. There are currently 20 anticonvulsants out there on the market. We need new options. The vagus nerve stimulator is a good new option. We have new medications coming along that are different. There's a new one that we've been trying called perampanel that is different. Cannabidiol is different. I view it as a medication. I don't want to view this as a political issue concerning the legalization of recreational marijuana, the legalization of medical marijuana. We want to be able to use cannabidiol in a responsible fashion. That will mean that we need to go through specific channels and evaluate the safety of cannabidiol. Is it even effective? There's very little research right now that supports whether it is or is not effective. We need that research at this point.
And you talked about there are 3 tiers to this. Can you tell us about that? Because cannabidiol is very much different from this whole subject matter to some degree.
And I think this confused a lot of people with the medical marijuana amendment. I was against that because I don't want a free-for-all like we have in some other states of people trying to obtain prescriptions so they can go smoke dope. That's a whole different issue. That's not a medical issue. I don't want to be involved in that as a physician. I want to be involved in responsible care for my patients. We have straight cannabidiol that is pharmaceutical grade. There are 2 companies, to my knowledge, that now make that, and it is in the research environment. Those studies are just starting throughout the country. We will be involved in those. Our colleagues in Miami will be involved in those. And that's an FDA-approved, rigorous research trial on straight, pure cannabidiol. There is medical marijuana, which we call the low THC marijuana, high cannabidiol marijuana, and that is what the legislature is working with at this point. And then there is straight, what in my youth was called dope. It has a high THC content, so there's a lot of mood-altering properties to it, and it has cannabidiol in it. Okay. There is some good research that shows cannabidiol can be effective in some patients.
That's where I was going with this, because you advocate the research of this and that sort of thing. And you're not going to know what it does until you're able to do the research. That's where you're at.
It's amazingly small, the amount of literature available on cannabidiol. The expert in the country is probably Dr. Davinsky in New York. And he has reported, I think, 23 patients that they looked at with complex epilepsy. Like the Hyman family, and about 30% of those patients in that trial had a 50% reductions in their seizures. Doesn't mean they were cured, and that was the confusion again with the medical marijuana. People were told it's going to cure epilepsy, and our job in these complex patients is to make their life as good as possible. If we can cure it, wonderful, but that's doubtful. Cannabidiol has been shown in these small studies to help a small group of people. That's the data we need to gather. We don't know if it's safe yet. We don't know if there's going to be long-term problems. We need to get that information together. And it's my understanding that our legislature has done a great job in trying to control this, trying to develop a program where we're not going to be willy-nilly. We're going to have some research ongoing, and that we can do this in a responsible fashion rather than going to California, Washington, or Colorado and just obtaining it with no real assurances that what we're doing is safe for our children.
And you're sort of passing the baton in many ways right on over here to Barney.
That is correct.
He's a lobbyist. Yes. Tell us a little bit about what's going on here.
Well, I think the legislature passed Senate Bill 1030 last year that allowed for low THC. Then the Department of Health was required to then promulgate some rules. They've been through a bunch of rule promulgation. There's been some problems, some issues, some misunderstandings about it. And then there's also been some challenges to those rules, which always happens. So as a result, the Department of Health has had a couple of more hearings. They're going to have another one on March 2nd, which will be the opening day of the legislative session the week after next.
Okay. Want to talk about, our producer was just asking me a question. Apparently, in some of our discussion, she had a question. She wanted to know about the cannabidiol and what was I'm sorry, Charlotte's Web. Was it considered a cannabidiol? Because most people hear of Charlotte's Web.
You may know that more factually than I do. It's my understanding that is a low THC marijuana extract. Okay. Is that a reasonable?
Yeah, it's a name brand.
Okay.
So it's like Kleenex for a facial tissue.
Sure. Thank you. Okay, we've got Mr. Hyman on the phone again here on the Aware Show. He's a parent advocate, and he has a child, a 9-year-old, who has epileptic seizures. And he's on the phone, and you have a comment that you want to make?
Yes, I do. I have a lot to say, and I probably would take up the rest
of
your show.
Go right ahead.
A couple of things. I have said many times before the legislature, in the media, Senate Bill 1030 calls for a low THC, high CBD oil. It has been referred to in the news, in the media. Florida has passed the Charlotte's Web bill, the Charlotte's Web law, Charlotte's Web legislation. Charlotte's Web is a brand, just like Kleenex is a brand. So as wonderful as what they have done, we're reinforcing a brand, and what's going to happen is that when there is available low THC, high CBD oil throughout Florida, The problem that I foresee is that patients are going to go into one of these 5 dispensing organizations to get this oil, and they're going to go into one, let's say in South Florida, and say, I want my Charlotte's Web, and unfortunately that Charlotte's Web brand is probably, if they're awarded a license, they'll probably be in one dispensary in the state. We're not really sure how many will be available for each organization, but again, it is a brand. A couple of other things I just wanted to touch upon real quickly. I've been actively involved with low THC, high CBD research over the past 4 to 5 years, so I consider myself somebody who has a lot of knowledge on it. And a couple of things that Dr. Renfroe said, I totally disagree. One is the Epidiolex trial that GW Pharmaceutical is currently doing, and yes, they are doing it down in Miami and some other hospitals in the state of Florida. It's a pharmaceutical-grade oil that contains only cannabidiol. It doesn't contain THC. The oil, like Charlotte's Web or other high CBD, low THC oils available, they contain an extract from the entire plant. And the success rate of the Epidiolex has been relatively low to what they were anticipating. And Dr. Renfroe is correct. The current word out there is about 30% of the patients have some sort of seizure control. But one question I would like to ask Dr. Renfroe, and he made a comment about the THC. THC is a very important compound in marijuana for medical reasons. One of the things that it has shown is that some children need higher THC levels to calm down their brain than others. So if you have a CBD oil that has 0 THC, there's a good possibility in a good percentage of patients that they might not have success. Whereas if you increase the THC levels, they may have more success in controlling their seizures. And my question to Dr. Renfroe is that how many epileptic medications out there, from Topamax to Keppra to all of these toxic pharmaceuticals, how many of them are mood altering? I could tell you of the 25 or plus medications that my daughter has taken, and I think maybe Sherrie and Michael might agree to this, that they're mood altering, they're behavior altering drugs. My daughter from Keppra and Topamax, she had severe behavior problems where she would bite her hand until she was bleeding. So to say that a little THC in a cannabidiol oil could potentially be harmful, what about these medications? My daughter last week tried for the first time another new drug called Dilantin. My wife texted me. She said, Seth, it's been a week. We need to take Rebecca off of Dilantin because, and I have it in front of me, it was a text of handwritten. She wrote, tremors, chills, nausea, decrease in appetite, increase in seizures, excessive drooling, dark stool, slouched posture, and insomnia. That's just to start. So it's frustrating for me to hear comments when physicians will make comments about the potential dangers of THC in an oil like this when the very same drugs they prescribe are toxic and cause more behavioral altercations in the patient.
Thank you so much, Seth, and thanks for sharing that with us. Dr. Renfroe?
What we do here is fascinating. We hear a lot of frustration. My job is, as an epileptologist, is to work with children with epilepsy. Most of those are easy. We start a medication, they have minimal side effects, they do great. I've got many in college, many in medical school. It's the difficult ones that we are not sure what to do with. I do hear the frustration. What we have to do, though, as a physician and as a researcher and as a scientist, I have to step back and not get my own personal emotions involved. I have to be able to see, is this safe for Tori? While I understand that there are people that feel cannabidiol may not be the answer, we need to research that. Do we need THC in the cannabidiol? There's no literature to support that in any fashion. There's never been a study that I'm aware of that did a placebo-controlled trial using Charlotte's Web. Florida's legislature has wanted to do this. They want to get in here and organize a rational approach, evaluating the safety and effectiveness of Charlotte's Web type medications. They want to look at other forms, other mixtures of the THC versus cannabidiol versus the numerous other compounds within the marijuana. Marijuana is psychoactive, that's the point. Cannabidiol is psychoactive. Cannabidiol, we believe, binds in the temporal lobe, which is a very epileptogenic part of the brain. So we think that it can settle down in certain kids who haven't been responsive to other medications, their seizures. Those kids are probably different. We haven't had a medication before that will work like cannabidiol. It binds CBD receptors. CBD receptors in the brain propagate seizures. So if we can settle that down with specifically attacking that with cannabidiol, we're in good shape. Do we need THC? I'm not sure of the emotional component of why we are against pharmaceutical studies and controlled studies of the oils that are derivatives of marijuana plant. We can't just give Tori a medication that people on YouTube say works. That's not safe. It's not a good idea. I have to have good data to know that medications are safe. We approved a drug many years ago when I was in training, 20 years ago, that is still around, and it worked really well for about 2 years. We thought this is going to be the best thing since sliced bread. Then people started dying. They started having liver failure. They started having bone marrow failure. And we pulled way back on that drug, yanked it off the market. It's not safe. Then we come back and say, we need to evaluate it. It did work for some kids, but there are dangers here. I don't know what CBD is going to do. We don't have that data yet, and it is up to us to be responsible to obtain that data.
Okay.
Dr. Renfroe?
Yes, sir.
How many people in the United States have died as a direct cause of marijuana? How many more months or years does a parent like Sherrie, who said earlier, she doesn't know if this is going to be the seizure that takes her daughter? How many more years and months are us desperate parents going to have to wait before you go through all of your placebo and all of your studies? Our children may not make it, Dr. Renfroe.
I'm not sure of why we have the emotional involvement here. We do have parents, and they are very concerned about their children.
Right.
But I do have to step back and say, is this safe?
And I think that's that's the fair thing. I certainly appreciate Seth's his questions, and he has questions that parents like who are here on our set have those kinds of questions in the back of their mind. So he's being that advocate for that, and I certainly understand that, and we respect that. But I don't want
it's a team sport,
right? Absolutely.
Mr. Hyman is obviously a loving father, and
yes.
I hope he has a good neurologist that he's working with. I love these people. I know they're native. We grew up together. And they have a complex, beautiful child, and I will do anything to help that child. And
I want to come to them too, and I'm going to get you back in this, Barney, with what's going on and what can be done. But in speaking, having Seth talk and listening to Dr. Renfroe, something that you all said to me in the green room was pretty much along the lines of what Seth is saying. Mm-hmm. You're looking at, we're able to take the pharmaceutical drugs and those sort of things for our daughter Victoria, but why can't we try something natural that may not be as toxic to her? Not that we're saying that the drugs are toxic, but,
very good point.
But parents have that concern. Yes. I have that concern in medications that I have to take. So I can understand. Do you want to make a comment about that, Sherrie?
I'm all for trying to find something that's going to benefit her.
More natural? Is that what your thing is?
More natural even. But there again, without the clinical trials, I don't want to just throw something to her that could harm her either. I want to know that there's studies being done, and we've got to start somewhere. If CBD is one study, it can add the additional THC elements as things progress, if necessary, if there are things that are being added that will help.
But that's her case.
That's her case.
In Seth's case, and with his daughter, then you know, he's not a doctor, but he has certainly done his homework, you know, and knows a little bit about what he's talking about. You can tell, and very passionate, and we appreciate that. How do we, when we look at this, it comes back to the medical. It's medical. We're talking about medical marijuana. It comes back to what medicine is dictating here, and your restraints with research.
It's to an extent. We use medicines that may not be FDA approved. We have a medication called deflazacort, not available in the United States, but it works really well with our children with muscular dystrophy. So we will advocate for the parents. Get that from the islands, get that from Canada, do whatever we can. Let's get it approved in the States. Cannabidiol will advocate for that, but the literature's still out. There's hope that this will help, but we don't have an answer yet. And without an organized approach, we will never have an answer.
And is that where we're at, Barney? Are we having a disconnect with how to find an organized approach? Or are we just looking at people going, oh, medical marijuana, just an excuse for people to use, like, as Dr. Renfroe say, just to smoke dope?
Yeah. Well, I think we have to get away from Amendment 2 because Amendment 2 was poorly written. It had a big open-ended part to it that said that a physician could give it to somebody for just about any reason, and it had tens of thousands of caregivers. People are going to be carrying pot around, which law enforcement can't keep track of them. So there was a lot of problems with the Amendment 2 the writing, the language of it. The new version of it is only marginally better. The place to take care of this issue is by putting it into the statute. So that means going back to the Florida legislature. And already Senator Jeff Brandes from Tampa and Representative Greg Stubbe from Bradenton have each filed bills of medical marijuana into the legislature. And so the legislature is going to be looking at those. I think ultimately what's going to really pass is going to be a bill that takes smoking off the table but allows vaping. I think that it's going to need to be probably limited to the 9 specific diseases listed in Amendment 2. But there's the potential of having medical experts that on an annual basis, maybe twice a year, would advise the legislature to add this disease or take this disease off the list. And then the most important piece is something that the Smart Justice Alliance has been pushing for from the beginning, and that's the research component. So how do we go about to do that? Well, the only official pot farm in the United States is over at the University of Mississippi. They've had it for about 35 years. And it's actually funded by the National Institute of Drug Abuse called NIDA, N-I-D-A. And so we believe that there's a potential of having a subcontract between a research entity, and this isn't a legal definition, but I'd say a research entity being either a research hospital, a research university, or a research institute like a Scripps, a Torrey Pines, a Max Planck, something of that nature. One of those or a number of those entities might have the potential to have a MOU or a memorandum of understanding or memorandum of agreement with Ole Miss to get that low THC and that medical marijuana from them and conduct that research. The research universities and the research institutes are primarily concerned about the reputation and the potential loss of federal revenue. So what a bill could potentially do in the research component would be a couple steps. Number one, decriminalize the research of both low THC and medical marijuana so nobody gets in trouble at the state level for doing that. Everybody says, okay, but you haven't solved the federal issue. Well, number one, the Congress just passed in a joint budget resolution last month saying that no federal agency can interfere with the state that's already got medical marijuana or low THC or recreational marijuana. And then number three on that part is that the president's already said that he thinks that alcohol is worse than marijuana. I'm not sure that I agree with him, but nevertheless, I think we can assume that the feds aren't going to be coming in and busting any researchers. So then the second thing is then establishing maybe as many as 5 research entities in Florida that could each apply for, say, up to $2 million a year and use that $10 million of recurring funding, that Florida would then become the first state in the country to conduct the research that Dr. Renfroe and parents are asking for. We'll have some very preliminary data within a year or two. We'll have the real data probably in 3 to 5 years. It would need to be double blind. It'd need to be crossover. It'd need to be longitudinal and need to be tracked, which is why this is probably a 5-year project that would cost the state $10 million a year. And if we do that, then Florida can help its citizens it's parents who are concerned about their children and their family members, we can help them to make better informed decisions, and it'll help the legislature as well.
What can you say to parents now? You're just saying wait.
Well, no, not really, because number one, you already have 1030 that's into law. You have low THC that the rules are trying to be promulgated on. If nobody challenges the rules, then on a March 2nd hearing, that'll be the week after next, then that can go forward. You have to hope that nobody challenges the rule after it's put out on March 2nd. About 21 days later, that rule will go into effect if nobody asks for it. So what you have is the ability of low THC to come around. The question's going to be, is 5 growers really enough? Because in Colorado, the largest grower only can grow about 15,000 tons of marijuana, and by the time you synthesize that down to an oil, then it may take more than 5 growers. But that's an argument that the legislature will handle. Ultimately, the legislature is going to listen to the Florida Sheriff's Association and the Florida Prosecuting Attorneys Association from the law enforcement side. And from the medical side, they're going to listen to the Florida Medical Association and the Florida Osteopaths to advise them on the medical aspect of it.
Dee Dee?
Yes, go Seth.
You know, a couple of quick things. I am in full support of any kind of research and studies that could be performed on medical marijuana. There are so many unknowns. We don't know exactly why it works and how it works. I think, you know, as far as research, it is so, so important. One of the things that Mr. Bishop just mentioned was we have Senate Bill 1030. Yes, we do, but unfortunately, the truth of the matter is that after the March 2nd hearing, even if the rules are not challenged and it proceeds, it will take approximately another 9 to 12 months for us as a family to have oil in our hands to give children. So it's 9 to 12 months from March 2nd or the end of March. Can my daughter wait? Can Victoria wait? I know I don't want my daughter to wait. So I think one of the biggest mistakes that I made as a parent and an advocate when this whole thing started with House Bill 843, one of the mistakes that I made that I did not lobby for the opportunity until Florida gets its act together and has oil available from grown here in Florida, that I as a parent have the right to get the oil any way I deem fit. And yes, it is a federal offense to cross state lines with it, but you know what? If I want to save my child and somehow I get it here and I give it to my child and I'm caught, I cannot be prosecuted. And you know what? I think that's what needs to take place this legislative session immediately. Some sort of legislation that states until Florida has it available to their citizens, grown here and produced here, that if a family or an individual here is caught with low THC CBD oil, they cannot be prosecuted. Once it's available here, then you can no longer do that. That's what I would like to see happen.
It's my understanding that the Florida Supreme Court has already set precedent that they will not prosecute someone who uses marijuana for medical use where there is no other treatment available.
Now, you're referring to the Jenks case for medical necessity, which I'm very familiar with, and there happens to be a landmark case this Monday that's starting in Broward County, the first medical necessity case. What you said is correct to a certain degree. The problem with that ruling is that you have to be charged first, and then you use medical necessity as a defense. So basically, I can get arrested, my child could be taken away from me by DCF, and then I would have to go fight it in court, fight it as a medical necessity defense.
And I think that the Florida legislature could, Dee Dee, absolutely address this issue for Mr. Hyman and other parents, because it is going to take a while for them to be able to develop it in Florida. No question about it. At the same time, I would also say that parents can go and get that now and bring it in. And marijuana, whether it's legal or illegal, whether it's medical marijuana or not, or low THC, there's a lot of it that's going across state lines right now. So I think that the chances of a parent getting caught are probably de minimis, But there is that potential, and then, as Mr. Hyman said, you have the medical necessity fact. But that is part of the bill that was introduced in the House to provide a defense for those people. But Mr. Hyman is right, you'd have to be arrested first, and certainly parents don't want to have to go through that. But in order to follow the Florida law, you're going to have rule promulgation, and that is going to take time. But low THC is going to be available, and I believe that there's going to probably have to be a glitch bill on the low THC, because I think the THC is going to probably have to increase some, and I think maybe even the ratio between the THC and the CBD is going to have to be changed. So there's going to be a lot of operational issues. How many dispensaries are going to be? How many growers are there going to be in each region? Can you win in more than one region? Can you supply medical marijuana or low THC to the entire state if somebody else is a grower isn't able to produce it in their part of the region of the state? So there's going to be a lot of issues that need to be addressed, and I think that the Florida legislature will do it. Certainly by 2016, the sooner they can do it, I think the better it's going to be for everybody.
I'm asked all the time, why don't, if I want to keep my daughter alive and I don't want to leave Florida, it's not that I don't want to, we can't, why don't I just get it and give it to my daughter? And the response to that is, my daughter has nursing. My daughter needs 24-hour care. If anybody sees or is under the impression that we're doing this, they would have to report it to prevent their license from being taken away. If that happens, the services that my daughter receives from the state of Florida, from what I hear, could possibly be taken away from her. So not only could my daughter be taken away from me from DCF, her services could be taken away, and I get arrested if we're caught doing that. Is that something that I, as a desperate parent, should be facing and worried about? Well, I'm sitting here now talking to you on the phone. You know what I'm doing? I have a monitor in front of me with video and audio watching my daughter sleep. Because you know what? I know in the next few hours she's going to have a seizure.
Yeah. Wow. And I think, Mr. Hyman, I certainly understand what you're saying. That's a worst case scenario, and I don't think that that's going to happen, but it could. There are a lot of worst case scenarios, but Florida is moving quickly, but because we do have a rule promulgation process, and that is very specific, and it gives people the right to challenge those, you know, the state's not going to be able to just wipe that out. But to get to the issue that Mr. Hyman was talking about having access, the Florida legislature could do that right now during this session and pass a bill early and get it to the governor. So that's certainly a possibility.
Go ahead, Dr. Renfroe.
There is a path that is being neglected with the legislature, and that is a federal path through the FDA approval process. THC is already available as an FDA-approved medication that we've used since the 70s, and we use quite frequently. It's not even a controlled substance. Marinol is straight THC. It works very well in our patients with cerebral palsy. They use it in patients with Parkinson's disease. I can write you a prescription now. Cannabidiol is currently being studied with two major companies pushing it. They already have studies ongoing. In some places, we'll be launching studies here in April or May. Throughout the country, cannabidiol will be studied. There are methods around this through a path that is functional. We need to remember that we don't have to reinvent the wheel here necessarily. I suspect that the legislative issues will become a moot point once the companies come through, we do some good research. Marinol is available. If that's added to a patient on cannabidiol and that provides better benefit than cannabidiol alone, that's really wonderful. That's very doable. It's legal. There's nothing wrong with it. No legislation needs to be passed.
Seth, this is Dee Dee. I wanted to ask you a question. Has your neurologist for your daughter, Rebecca, told you that this is the medical marijuana would be beneficial to her? Is that why you're really pushing for research and to be able to use this with her? Is that basically what your advocacy has been?
My daughter's neurologist is Dr. Ian Miller at Miami Children's Hospital.
Yes.
He's been her neurologist for many, many years. I started talking about the benefits of medical marijuana oil with Dr. Miller many, many years ago. Okay. So it was really me who was pushing it. It was me who was saying, look at what's going on in the other states. Unfortunately, you might not know this, Miami Children's is currently doing Epidiolex trials through GW Pharmaceutical. I was told by many at the hospital that 2 years ago when we started talking about this, that because of Rebecca's severity, Rebecca will be top of the list based on her medical needs for the Epidiolex trial. Well, guess what? Miami Children's Hospital recently started Epidiolex trials. Rebecca is not going to be part of it. Why? Because it's a lottery. They're choosing 25 patients from different age groups, and you have to win the lottery to get chosen. Unfortunately, my little Becca is not part of that lottery.
I'm sorry.
And we all have to advocate for our children. I have to advocate for my patients. Mr. Hyman has to advocate. Nobody will do a better job than the Johnsons.
And Dr. Renfroe made a great point, and as much as I'm an advocate for the benefits of medical marijuana for all patients, low THC, high THC, there are 20,000 studies out there showing the benefits of medical marijuana. But what I do want to say is what Dr. Renfroe said about THC. Marinol is a synthetic form of THC. It is not beneficial to many patients who have had success with true medical cannabis. But at the same time, there could be potential benefits of using a synthetic THC, and no one has ever spoken about, and I know this could be done because I went down this route, nobody has spoken about a synthetic CBD. Now, can it be beneficial? I don't know. Nobody knows. But you know what? I think patients should have all options. So if there was a synthetic CBD, which I was told is very inexpensive to produce, and it could be produced very quickly, and then you combine that with trials of Marinol, that might be an answer there, but no one's talking about that. And the reason why I bring it up is because I think patients need to have all options. Whole plant cannabis is important, but we need to have all options.
Gotcha. Okay.
What do there are two companies producing what do you call it? CBD?
Cannabidiol.
Yeah, that's it. Cannabidiol. One of them is a synthetic, one of them is a derivative. So we will have a synthetic form of CBD being tested within the next year. As we know, going through the FDA is a slow process. However, they put this on fast track. If a drug is shown to help children with epilepsy, it will just blast off, and they will start to incorporate more and more people. The initial trials that Dr. Miller is doing has 25 patients. Within a few months, they're going to have that data back in. They're going to show that it is safe. They're going to open it up to 100 patients. They're going to open it up to 1,000 patients. So your daughter, you need to advocate for her. I've been through that system. I do understand what you're going through. I advocate for this beautiful young lady and all of my patients. We'll have about 10 patients in the initial CBD trial.
But we also hear that Epidiolex has not been that effective as what they originally thought.
But Mr. Hyman, we hear that. I hear that Charlotte's Web is effective. I don't have the data. Let's step back and not be overly concerned about what we hear, and let's focus on data.
Of course.
Let's get data in with beautiful patients that are real, not people who get online because they really are making a fortune. The company that owns Charlotte's Web is making a fortune. Follow the money. I'm advocating for the patient, not the company that makes Epidiolex, not the company that makes Charlotte's Web. I want to see a product available for my patients that is reliable, that is tested, and that is safe.
And I know that as parents, you all want that as well.
Absolutely. Absolutely. That's why we trust him. I mean, Dr. Renfroe has actually had us go to Miami before. Said, look, there are certain things that I want you to try somebody else, see if there's something out there that I'm missing. And, that's why I trust his judgment. I'm not a chemist. I'm not a botanist. I can't tell you one chemical from another. I have to trust the doctors, the people who have gone to school to be able to learn all these things. Yes. And quite honestly, Dr. Renfroe has put us in other directions away from him so that we could try several different things. And with that in mind, believe me, that's why I have my trust in him. And we've tried, my gosh, I don't know how many different types of drugs
out there, right?
We have. And, you know, to Seth's point, you know, he was talking about several drugs that he had tried that have completely changed his child's attitude and, you know,
Mood, yes.
she's been through the same thing. Yes. It could be, you know, night and day, but, you know, God love her. She's, it's something that we hope that someday we'll get her to the point to where she doesn't have the seizures that she has.
Yes.
And, you know, day in and day out, we always have faith in it. So,
you know, Sherrie and Michael, the feeling that you have as parents, and I share the same feeling when your child is on the floor, they're blue, and they're not breathing, and you have the phone in your hand, and you have 911 on the other end, and you're screaming into the phone. Nobody could feel what we feel during those moments.
You're absolutely
and it is
right.
the most scary, horrific feeling that you can have as a parent.
it is. It really is. And if there was anything in the world that you could do to take that away, you know as a parent, you would do it. But
I have seen children in other states who I've seen firsthand, children who right in front of me were seizing hundreds of times a day, and this is many cases, and then 2 days later they go on, they go on CBD oil, and they're totally different. It is amazing what it does for some children. And again, I understand it's not going to work for everyone, but cases and families that I've been in touch with over the last 4 years, it has been unbelievable. I mean, folks, you know, sitting down there today, whether it's Mr. Bishop or Dr. Renfroe, have you seen firsthand the before and after effects of what a lot of these kids are experiencing in other states while our kids suffer? It is amazing.
Yeah, I think to go back to what everybody is saying, the important point that the Florida legislature is looking at, Dee Dee, is they want to help the parents. At the same time, they want to set up a structure in Florida where this low THC, high THC, the medical marijuana is not going to be available to just anybody for anything. And I think that's where it begins. So we have an old saying in the lobbying business that it's better to get a half a loaf than no loaf at all. So what we've been talking in trying to get this issue forward is starting with those 9 diseases that were specifically listed in Amendment 2, and then having the ability to add over time. The research is going to take a long time, but the legislature could address Mr. Hyman's issue about availability of the low THC right now. And then I think the legislature is also going to address the research piece. Florida has the potential of being the first state in the country to do this research. It's amazing that no other state has done it and the feds haven't done it, but Florida could be the first state. We're going to have to put some money in it. We only had $1 million put in to the low THC, but we're going to need more than that in order to make it work.
I think the interesting fact that I haven't brought up about you, Barney, is that you haven't always been an advocate for this, but now you're one of the biggest advocates for, the medical marijuana, especially the oil.
Yeah.
The oil is what our doctors and our patients are here joining us about.
Well, and I was an opponent to putting it into the Constitution. I wouldn't say I'm an advocate for having medical marijuana, except that I'm an advocate, if we're going to have medical marijuana, put it in statute, because the legislature could then address it every year. If you put it in the Constitution, it's only every 2 years, and it doesn't belong there, and you can't fix it easily. But I think the legislature wants to do the right thing. They're going to want some data down the road, but that is going to take time. But there are stopgap issues that can be done. Do a glitch bill on the low THC, do something about medical marijuana, take the smoking off the table but allow the vaping, do the research component, decide how many growers there's going to be for this, make sure they can meet the demand for that, and then I think the legislature is going to move on that issue and try to make it happen.
Well, for families like Seth, you know, and for the Johnsons here, we hope that whatever can be done as far as the politics of this can be done so that doctors like Dr. Renfroe can do the best to improve the quality of life for patients like Victoria. And, you know, we've kind of allowed your parents, because They're your advocates and they've been talking. But do you have anything that you want to share on the Aware Show, Victoria? Anything at all?
I like animals. I got 3 cats, 2 dogs.
And they like you.
Right.
And your parents are, I know that you'd like to thank them for all that they do to make sure that you're as healthy as you can be and live a lovely quality life.
I like cook.
You do?
Yep.
Okay, well then you can come cook for me because I don't like to cook.
I like doing the silverware.
Okay.
Do you?
Very good. Is there anything that you want to add, Sherrie?
No, I think my biggest thing with the CBD too, as Seth touched on, you know, we could go out of state and bring it in illegally, but there again, how do I know what I'm bringing back is what it's supposed to be? Okay. I don't know if I have the research capabilities to track down the right stuff, and then if I bring it back and I bring it to my doctor, he legally has a responsibility to, if he wanted to, turn me in for bringing something in across state lines.
That's what Seth said.
So, you know, there again, it's a catch-22.
Yes.
But know that your doctor has no legal. I do not. That is, I will not turn you in for whatever you choose to do with the best interest of your child in mind.
And you know what? You just brought up a very important point that we're going to face as patients here in Florida. As of January 31st, 2015, there have only been 12 physicians who actually completed the online required course with the Department of Health for the enable doctors to order the low THC oil. The problem that we're going to face is that, one, doctors are going to be incapable of, even after these courses, many doctors, not you, Dr. Renfroe, but many other doctors are going to be incapable of properly dosing and recommending on how to use the oil. For an example, too much CBD may cause seizures. Too much THC may cause seizures, and vice versa. So even if you brought it back from another state, there is so much tweaking that's going to be needed until you find the right fit, the right dosage, the right combination of CBD and THC that has a positive effect. That could take some time.
Yeah.
And doctors don't have that experience here.
And parents don't want their children to suffer in all that time. I get that. We want to share some resource information with you before we close here on the Aware Show. If you want additional information, here's where you need to go. We've had our guest here, Dr. James Renfroe, who's a neurologist. If you'd like some additional information from him, he's given us that information. Florida Smart Justice Alliance as well. Jot those numbers down, and if you want some additional information on what's being done to let's say, progress the potential use of medical marijuana, especially in the oil form, as Dr. Renfroe is advocating research and the like. Any closing comments quickly?
I see that we all have the same interest in mind, and I appreciate Mr. Hyman's emotions and input because we're right there with him. I do want us all to know that we're on the same team. We can argue, we can fight, but when it comes to it, we're here for Victoria.
And
I know that, and I truly appreciate that. And the first time I met Mr. Bishop, we were on a panel. I felt like I wanted to go over and shake him a little bit, but after that,
that's all right.
You know, the one thing that I want to leave you with.
Yes, quickly.
My daughter Rebecca, when she's having a seizure, she looks at us and says, "Mommy, Daddy, please help me and do something." And Rebecca doesn't talk. But that's what we see and feel.
Well, we're going to do something. We're going to be praying for her, you, and your family. For all of you, thank you so much for joining us. And thank you for joining us as well by phone, Seth Hyman. Thank you for joining us. Until next time, stay informed and stay aware. I'm Dee Dee Sharp. Good night.